The silence here is eerily, bar the sound of the beeping machines. This is the intensive care unit at Mulago National Referral Hospital, which is currently full with COVID-19 patients.
The number of the patients will not go down, provided people have not done the following. We must have social distancing, we must have the mask on, and you also must have the other SOPs to wash your hands and sanitize your hands. Otherwise, even if we have all the ICUs, we will not decrease the numbers and we will not control the virus.
In heavily sedated rooms, these patients need the aid of machines to breathe. No visitors allowed, and we had to be heavily protected with PPEs to access the place. The situation here is worrying, and the doctors are preparing for the worst. Dr. Henry Mwebasa, the Director General of Ministry of Health, noted that the country has hit the mark of more than 1,000 cases reported daily.
Starting initially with about 200 cases per week in early April, first and second week, we are getting about 200 cases per week. But towards May, this started growing. The first week of May, we had over 400, about 418, and the second week, the same. Actually, the third week, it jumped to 918 in the third week of May, and then thereafter, we hit our 1,000. So now we are actually getting 1,000 per day.
The Director General notes that currently there are over 6,034 cases admitted in general referral hospitals. Of these, 20 are critical and 246 admitted in the high-density units, meaning more than half of the patients admitted require high flow of oxygen.
As we talk, Mulago is full, and most of our regional referral hospitals are full. The most affected districts are so far Kampala, Wakiso, Moyo, Gulu, Amuru, Oyam, and Kalunga, and many others really.
The outgoing Minister of Health, Dr. Jane Ruth Acheng, appealed to all stakeholders to work together to defeat the daily virus.
And right now, our health workers are tired. I'm trying to whisper that, but I can't. They are tired. They are fatigued. The pandemic has gone on for too long. Even the population is tired. Everyone is tired. But it is not time for us to get tired. It is time for you to breathe in and out, get up and get going.
The second wave that has hit the country is characterized with several variants, as experts explain.
But more worrying is the South Africa, the UK, Nigerian, and Indian variants that were identified. The South Africa variant was identified mainly in truck drivers that were sampled from the points of entry in Malaba, coming from Kenya, and from Mutukula, coming from Tanzania. The same as the UK variant, sampled in truck drivers from Mutukula mainly, then the Nigerian variant. The Indian variant found in two clusters, one in Jinja and one in Kampala.
Health experts note that they are getting clusters of infections breaking out of schools, largely because of some schools did not adhere to guidance and SOPs that were given by the Ministry of Health.
That's why we are seeing even many cases among children with the severe symptoms, which was not the case in the first wave. We were actually not worried about children. A child could get sick, you'll allow him to go and run, and then it would be okay. The only concern at that time was that the children would infect the adults.
There's also a large number of cases that remain in the community. As I mentioned, at least 90% of all the cases are in home-based care.
With the surge in numbers of COVID-19 patients going up and hospitals filling up, health workers are fatigued and mortality rate might go high. The public has been advised to strictly observe the standard operating procedures. Zahra Abigaba, UBC.